6 Easy Ways to Lower Blood Sugar Levels Naturally. High blood sugar occurs when your body can't effectively transport sugar from blood into cells. When left unchecked, this can lead to diabetes. One study from 2012 reported that 12 to 14% of U.S. adults had type 2 diabetes, while 37 to 38% were classified as pre-diabetic. This means that 50% of all U.S. adults have diabetes or pre-diabetes. Before starting the videos, please like, share and subscribe our channel to getting more videos about health and care. Here are 6 easy ways to lower blood sugar levels naturally. 1. Exercise regularly. Regular exercise can help you lose weight and increase insulin sensitivity. Increased insulin sensitivity means your cells are better able to use the available sugar in your bloodstream. Exercise also helps your muscles use blood sugar for energy and muscle contraction. If you have problems with blood sugar control, you should routinely check your levels. This will help you learn how you respond to different activities and keep your blood sugar levels from getting either too high or too low. Good forms of exercise include weightlifting, brisk walking, running, biking, dancing, hiking, swimming and more. Exercise increases insulin sensitivity and helps your muscles pick up sugars from the blood. This can lead to reduced blood sugar levels. 2. Control your carb intake. Your body breaks carbs down into sugars, mostly glucose, and then insulin moves the sugars into cells. When you eat too many carbs or have problems with insulin function, this process fails and blood glucose levels rise. However, there are several things you can do about this. The American Diabetes Association (ADA) recommends controlling carb intake by counting carbs or using a food exchange system. Carbs are broken down into glucose, which raises blood sugar levels. Reducing carbohydrate intake can help with blood sugar control. 3. Drink water and stay hydrated. Drinking enough water may help you keep your blood sugar levels within healthy limits. In addition to preventing dehydration, it helps your kidneys flush out the excess blood sugar through urine. One observational study showed that those who drank more water had a lower risk of developing high blood sugar levels. 4. Control stress levels. Stress can affect your blood sugar levels. Hormones such as glucagon and cortisol are secreted during stress. These hormones cause blood sugar levels to go up. One study showed that exercise, relaxation and meditation significantly reduced stress and lowered blood sugar levels for students. Exercises and relaxation methods like yoga and mindfulness-based stress reduction can also correct insulin secretion problems in chronic diabetes. Controlling stress levels through exercise or relaxation methods such as yoga will help you control blood sugars. 5. Get enough quality sleep. Getting enough sleep feels great and is necessary for good health. Poor sleeping habits and a lack of rest also affect blood sugar levels and insulin sensitivity. They can increase appetite and promote weight gain. Sleep deprivation decreases the release of growth hormones and increases cortisol levels. Both of these play an important role in blood sugar control. Furthermore, good sleep is about both quantity and quality. It is best to get a sufficient amount of high-quality sleep every night. Good sleep helps maintain blood sugar control and promote a healthy weight. Poor sleep can disrupt important metabolic hormones. 6. Lose some weight. It's a no-brainer that maintaining a healthy weight will improve your health and prevent future health problems. Weight control also promotes healthy blood sugar levels and has been shown to reduce your risk of developing diabetes. Even a 7% reduction in body weight can decrease your risk of developing diabetes by up to 58%, and it seems to work even better than medication. What's more, these decreased risks can be sustained over the years. You should also be conscious of your waistline, as it is perhaps the most important weight-related factor for estimating your diabetes risk. A measurement of 35 inches (88.9 centimeters) or more for women and 40 inches (101.6 centimeters) or more for men is associated with an increased risk of developing insulin resistance, high blood sugar levels and type 2 diabetes. Having a healthy waist measurement may be even more important than your overall weight. Keeping a healthy weight and waistline will help you maintain normal blood sugar levels and decrease your risk of developing diabetes.